Hello, my name is Laura, and today I will be demonstrating intradermal injections while using general principles and safety practices. And the 11 rights are the right medication with the right patient, the right dosage, the right route, the right reason at the right time with the right documentation, the right data, the right education, the right to refuse, and the right reason. So first I will gather my supplies and I will check the medical order against the MAR. Okay. And I will know the effectiveness. I will know the safe dosage ranges, and I will know the adverse reactions, things like that. Okay. So next I will perform hand hygiene. Okay. So I will sanitize my hands. So today we are going to simulate the patient getting a tuberculosis test, okay? And she had an appointment to come in today at 9 o'clock. So we're gonna pretend like it's 9 o'clock and it's time for her TB test, okay? So after performing hand hygiene, I'm going to grab the vial that is got her medication in it for the TB test. I'm going to check it against the MAR, and it is the correct serum, and I'm going to see how many units I need, and I'm going to take an antimicrobial wipe, and I am going to clean the top of the vial. Okay, now I'm going to let that air dry. I'm not going to wave it. I'm not going to blow on it. I'm going to let it dry naturally. That way it doesn't get contaminated again. And I'm going to set it here to the side. Let that dry. Now, I'm going to grab the appropriate syringe. Now, a syringe for an intradermal injection, the needle length must be 1/4 of an inch to 1/2 an inch. The gauge must be 25 gauge to 27 gauge. And I've got one right here. Now, we must practice safety when using needles. So we're going to hold our needle with our thumb and our forefinger in our dominant hand, and then we're going to take off the cap with our non-dominant hand using an OK, double OK method. And we're going to slide the cap off straight. Okay, and we're going to put the cap down, and we are going to hold the needle with our dominant hand with our thumb and forefinger, and we're going to puncture the top of the vial while the vial is sitting on the table. So we're just going to puncture the top, and we're not going to touch the plastic part of the needle, like the base of the needle, to that puncturing site. Now, in one graceful move, we are going to invert, and we are going to hold the vial with our thumb and forefinger of our non-dominant hand while the syringe rests on the bottom of our palm, and our dominant hand is on the syringe, and we expel the plunger to the correct medication dose. The correct medication dose is according to the medical order received. Now, we are going to just take that syringe out of the vial, set our vial down, and we are going to check and see if we have any air bubbles, and we are going to push our plunger up until we get one tiny bit of medication in the bevel. But we're going to ensure that we still have the same amount of medication in the syringe that we need for our patient according to the order that we received. And we do. And that is proper. So what we're going to do is we're going to recap this. All right, and how we do that is we locate our cap, which is still sitting on our table, and we're going to use the scoop method. So we are going to scoop the cap, and very carefully we are going to, well, put it back on carefully. All right, now we've got our medication ready. We've got our needle ready with the right size, the right gauge, the right amount. And we did our 3 safety checks, and the third one, of course, is depending on the facility that you're at. So we are ready to go to our patient. So we will go to our patient, and we will either shut the door or we will pull the curtain. We will perform hand hygiene, and we will put on our gloves. Now, while identifying the patient, we want to use our 2 patient identifiers. Okay? Now, good morning. What is your name and date of birth?
Catherine, 7/26/1902.
Okay. And I check her bracelet, and it is the same as what I have on her record. And I check her patient number, and it's the same as what I have on her record. Now, do you have any known allergies that you're aware of?
No.
Okay. And it is the same as what's on her record that I checked at the very beginning. All right. Have you ever had a TB test before?
Yes.
Okay. So you know what to expect?
Yes.
Okay, good. Now, if she has never had one of these tests done before, then we talk a little bit about it. Then I would educate her and tell her what to expect and things like that. Now, with an intradermal injection, what we're going to do is we are going to inject the medication just under the skin, and there are 2 places where it's best for that. The first place is in the inner aspect of the forearm, which is right here. You want a location where it's not hairy and there's no rash or anything like that. So this is one location. The other location is in the upper back. Pretty hair. It's in the upper back, just under the scapula. Okay. Go ahead, sit down. Okay. So what we do next is we're going to clean the site. So we get our antimicrobial wipe, and we are going to clean the site. We are going to go in a circular motion from the inside out in a very firm wipe. Okay, inside out. And we're going to let that dry naturally. Of course, we're not going to blow on it, and we're not going to fan it. We're just going to let it dry naturally. All right, next I'm going to demonstrate this first. Next, we are going to pull the skin taut. And we do that by placing your hand under the arm of the patient, and you're going to pull outward. Okay, and that'll give the skin, it'll make it taut. Okay, and you do that while you do your injection. Now, just a little bit of information. While you are doing the injection, you want to go in at a 5 to 15 degree angle, and the base of the needle is sitting on the patient's skin. And you're going to inject this medication just under the skin, because when you inject the medication, there's going to be a wheal that appears. Now, what I have is what came in my lab bag, and it won't be showing a wheal, but if you just imagine, it'll be a little bitty blub that comes up in your skin. So you take your medication, and depending on the facility, what you'll do is you'll check it again against the MAR. So you'll check the amount that you have and the medication, where you got it from, and you will check it against your MAR to make sure this is in fact the correct order and medication against the order. And again, we're going to take the cap off using the double OK method. And then we turn to our patient. Are you ready? Okay. Again, we're going to take the hand under the patient's arm. We're going to pull it taut. And as we do that, I'll move my hand down here so I don't really stick you. We are going to make sure that the level of the needle is up. Okay, the level is the flat side of the tip of the needle. So while this is pulled taut, we're going to go in with the needle being held by our thumb and our forefinger. We're going to go in just 1/8 of an inch. Okay, now with our non-dominant hand, we're going to stabilize the bottom of the syringe. And with our dominant hand, we are going to push in that medication. Now, we went in at 5 to 15 degrees, so we're going to come out 5 to 15 degrees. We are going to activate the safety of that syringe, and we are going to, I capped it because it's our video, but we're going to activate the safety of the syringe and put it in the sharps container. Now, I'm going to take off my gloves, perform hand hygiene, and I'm going to tell the patient, do not scratch it, do not rub it, don't mess with it. Because the purpose is we're wanting to see a reaction around that site. And if they do that, that may interfere with the reaction. And so I'm going to document what I did, and I'm also going to observe any kind of immediate reaction, okay? And I'm also going to, like in a TB test, they come back in 2 days. I'm going to observe any kind of future reaction that she may have. And if it's an allergy test, any kind of future reaction that may happen that wouldn't be quite so in the future, like a couple of days. So, and then I would report and record those findings as well. So, thanks for watching.